भारती, गांधी विद्या मंदिर, सरदार शहर। इस वेब सीरीज में सम्मिलित सभी पार्टिसिपेंट का धन्यवाद करता हूं, जिन्होंने हमारी इस सीरीज को 2 दिन पहले सुना। और आज मैं उन सभी पार्टिसिपेंट्स का हृदय से स्वागत करता हूं जो फिर से इसमें सम्मिलित हुए हैं। आज की वेबिनार का विषय है प्रिवेंशन एंड मैनेजमेंट ऑफ लोअर बैक पेन थ्रू योगा प्रैक्टिस। इस आज इस विषय पे वेबिनार के लिए आज हमारी रिसोर्स पर्सन है डॉक्टर शालिनी मिश्रा, असिस्टेंट प्रोफेसर, पीजी डिपार्टमेंट ऑफ स्वास्थ्य एंड योगा, IPGT&RA, गुजरात आयुर्वेद यूनिवर्सिटी, जामनगर। डॉक्टर शालिनी मिश्रा, आपने MD और PhD राष्ट्रीय आयुर्वेद संस्थान जयपुर से पास आउट करी है। आपके 20 से ज़्यादा आर्टिकल राष्ट्रीय अंतर्राष्ट्रीय जर्नल्स में छप चुके हैं। इसके साथ ही आपका एक मोनोग्राफ और एक स्वास्थ्य विषय पे एक बुक भी पब्लिश हो चुकी है। आपकी MD डॉक्टर कमलेश कुमार शर्मा, एक्स HOD, PG डिपार्टमेंट ऑफ स्वास्थ्य एंड योगा के सानिध्य में हुई है। इन्हीं गुरुजी का मैं भी शिष्य हूँ। जो आप मेरे सीनियर बैच में आपने यहाँ से MD करी है, उसके बाद आप PhD करके यहाँ से पास आउट हुए हैं और वर्तमान में आप जामनगर में PG डिपार्टमेंट में असिस्टेंट प्रोफेसर के रूप में काम कर रहे हैं। तो स्वागत है आपका।
नमस्कार। All the members, respected guests, and students, very good morning. In the continuation of 3-day lecture series, today I am going to present one of the consequences of pandemic COVID-19 and lockdown. In this pandemic, many lifestyle disorders like diabetes, hypertension, cardiac disorders is going to increase. And in this group, chronic low back pain or lower back pain is also one of the most important disease is increases in the prevalence. And maximum persons not as much aware about lower back pain or general backache as much as diabetes, hypertension, and cardiac disorders. So I am very thankful to organizing committee and college for inviting me on this occasion. So in the continuation, I'm going to present my topic. So for the prevention and management of chronic low back pain through yoga is very easy and non-pharmacological. No need of any medicine required for the management of back pain. I think this is the best because due to medicines already have some con- uh, different types of diseases occurs. So non-pharmacological approach toward prevention and management for types of lifestyle disorders, because chronic low back pain is also one of the lifestyle related disorders, is very important and very useful. It saves money and also maintain the health. So on the occasion of day, because it becomes an international level, and yoga is a very important in the present scenario. And I think scenario is correct, but in this situation, as a complete lockdown and pandemic conditions, so yoga is very much important to maintain their health, and not only physical level, it also maintain the mental level and social level. So in the continuation, we start this. WHO also promote the yoga as a physical activity. It, because it maintains the muscle strength and flexibility and also health, but not yoga. It's by asana. This is asana. Generally, we give the name yoga of simple asana. Okay, asana is a part of yoga, not a complete yoga. So according to WHO, generally they focus on asanas for physical strength and flexibility and maintain health. But due to pandemic conditions and lockdown, it is not possible to go into gym and some yoga center and different level of centers. So it is important maintain yourself at home. That's why in, in this year, government started a theme, be with yoga and at home. So physical activity is very much important for lifestyle related disorders. Pandemic and lockdown boosted this lifestyle disorder, because already lifestyle disorders increases day by day. But due to complete lockdown and COVID-19 pandemics, it increases abruptly. So it is very important to consider the situation and manage them properly, because low back pain and other muscular disorders is not a life threatening disorder. So it is very neglected and not aware as much as diabetes, hypertension, and other cardiac disorders. But it is also disturb the quality of life. So it improves the quality of life by its management. How, what is the label of and what is the status of musculoskeletal disorders in lower as a lower back pain in the global level? On global level, it is a very important conditions. It is near about 16%, which create the disability in whole population. It is a very large number, 16%. It is a before lockdown, but after lockdown it increases very much. So in the musculoskeletal disorder, different types of disorders occur, but continuous sitting and steady postures, it started the spinal disorders, vertebral column disorders, and as sitting postures, lower back is very much stressed. So we first, and if we try to improve this functional activity, it is an important point to consider for the topic. Why in this lockdown it occurs? First, we see that this is a graph, how much it increased by sitting hours. In starting, sitting hour is this one, but maximum sitting hour is increased in up to maximum level. Is a gray, dark gray pillar show the maximum more than 8 hour sitting time for persons. So it is a very much increased, but previously white And previously, it is not as much. It increases day by day, but lockdown it boosted this situations. So it is very important to discuss this, and this is a gradual. If person are physically active, sufficient active, and highly active, even though this five is only highly active, and maximum inactive condition more than 8 hours is a sitting hour, it is a very dangerous situation. It is considered a sedentary life. Okay. So it's in causes very much a problem on the vertebral column, muscles, and functional activity, body movements. So in the continuation, it is published as article in the COVID-19 quarantine on low back pain intensity, prevalence, and associated risk factor citizen is increased. It's a cross-section study. So we can see this. The low back pain was also most commonly musculoskeletal pain area for the during quarantine or common lockdown is significantly higher. So it increases and more in middle age, 35 to 49 years, means more working group. Middle group is a more working group, means at home we continuously doing office work. In the office have some 3 hour 4 hour after have some break, but after lockdown it is a continuous. It's okay at home, so no need of any rest, but it is a dangerous situation, create a dangerous situation. The continuous 4 hour 5 hour sitting position is a very much dangerous. Need every 1 hour and 1.5 hour 5 minute rest is required to relax the muscles. So at home it's become considered as a relaxed area, but due to workload it's become a dangerous situation gradually. So it is also published in different more articles and have different study. It shows the different types of lifestyle related disorders increases day by day and more in functional group, middle age group. So it's a very burning point. Only COVID patient is not affected in the pandemic. Overall population of the global is affected due to this. So how it causes more low back pain? Because improper posture. Obviously, or at home have not a proper posture. Poor ergonomics at home. For proper work, proper office work, have not proper equipments, proper appliances, so it may causes problems. Lack of physical activity, continuous involvement in the work, and even bed, even for rest is also on sofa or bed, just wrong posture, and continuous watching TV. All these created different types of muscular problems and bone joints problems. Mental stress. This pandemic increases too much level of mental stress, and it also increases the pain intensity. Perception of pain is increased, and addiction. Obviously, alcohol addiction is much increased during this, and continuous eating and maximum population put on their weight, and it also one of the cause for the lower back pain. So this is the main situation created by the pandemic. So if all these situations, this is a factor for sufficient to increase the prevalence of low back pain and chronic low back pain. Chronic means more than 6 months if pain is occurs. So we discuss what symptoms appear after that. Pain from the more than 6 months, nearly 2 year goal passed on as a lockdown and complete pandemic as it is. So it increases maximum conditions and patients comes as pain. And but it is a very not a life threatening, that's why it is a very neglected, but it is not good for quality of life. So it creates pain Stiffness in lower area of the back, mainly lumbar and sacroiliac region. Pain can also radiate in the lower extremities or generalized. Due to nerve compression, it may radiate from downward area, so up to legs, and maybe at only same area, localized area in the back area. It obviously due to pain and stiffness, reduced mobility and functions deafness, all these are reduced. It leads to inadvertence from work. Obviously, work is not as concentrated person over work due to pain and reduce the social participation. Not obviously it for any work not as much easy to do functions from the body. And obviously if we uses pharmacological prevent management, obviously we loses our wealth and along with health. So yoga is without any money and non-pharmacological mode. It is a very important, and it all these situations created gradually depression and may leads to some other disorders. So this is a very much important symptoms which prevent the person to involve in their work properly and not able to enjoy every moment. How we can assess this? This is some different types of parameters. By this, we can assess how much level of pain in that person. So this is a grading visual analog scale for pain assessment. According to the, because no other agile lab investigations available. So this scale is the one parameter. By this, we can assess how much level of pain is there. So this is categorized in mild, moderate, and severe. So 1 to 3 mild, 4 to 6 moderate, and more than 6 comes as severe pain. So mainly occurs moderate pain started from mild pain. So this is a level of pain as much as occurs. Severe is very rare, mainly due to injury. And second thing is stiffness. How we can assess the stiffness of pain and at the joints in the lower back? It is also a rating scale. So it started from 9 to extreme. So as much as 3 up to 3 mild, 4 to 6 or 7 up to moderate, and after that is extreme. So this is a stiffness when person not able to stand properly, to walk properly and sit properly. So it is a very high level and very is divided. Next is difficulty in movement due to pain and due to stiffness. It can grade this difficulty in movement. How much movement occur? Means one can able to do their personal works without any problem is known. Mild problems, with mild problems, person can do their personal works and other works also. Second, person only able to do their personal work but with pain, moderate pain. And third, not able to do any personal work without help. So, and extreme is very painful and stiff conditions and very restricted movement in the grading of this fourth grade. So this is the overall symptoms and grading, how we can assess this. But it's the only cause and symptoms and how we can prevent and management. Different types of gel, medicine, painkiller is available. We can relieve it within 15 minutes. After that, after 1 to 2 hours, again it started and restricted movement suffered due to person with suffered with restricted movement and stiffness. So if we can use physical activity or yoga, then it gives the complete relief and also prevent the um, generate any type of generation of lifestyle related disorders. So if we try to do yoga practice, physical activity is also good, but physical activity is generalized activity. But yoga is specified, and which type of asana, which type of pranayama, which type of brahmi is good, which type of activity is good for, which type of asana is good for a specific disease. But general physical activity is also good for general healthy purpose in that situation, and disease condition is also improved by physical activity. But yoga practice is due to specification, and due to some mental effects is also, it is more important. So today we discuss this yoga practice. We design one module, and by considering the person, not every person able to do every asana, and some asana is easy and very effective in the lower back pain there due to their scientific reason. So we have created one module just for as a 45 minutes, 1 hour. It started with simple, just small joints movements for warm up. It's a warm up condition. Small joint movements to relax this for proper doing the asana. So first started with different types of level postures, standing, sitting, prone, and supine positions. Asanas is there. So we started with first of do the 10 minutes. We have to warm up condition, warm up movements, small joints movement to relax the neck, shoulder, elbow, wrist joint, knee joints, ankle joints. All these movements is required for doing the next asanas. So next is standing posture asana. In the standing posture asana, Urdhva Hastasana, that is, and Chakrasana. These are the standing posture asana. Next is sitting posture asana, Bhadrasana, and Uttana Mandukasana. Supine posture is Uttana Padasana and Setubandhasana. Prone position, Salabhasana and Bhujangasana. These asanas is done for 20 minutes. Means every asana near to 30 seconds and maximum. This is a maximum, but it started with 5 seconds, 10 seconds, and gradually we can increase the duration for a stay in any particular asana. So this is some minimum time for the practice of different types of asana, and at the end of all these, for relaxation, savasana, Visodhan, and Bhramri pranayam, and in the last is Om chanting. So this is a complete module which relaxes the body and mind both. So this is for generally for 45 minutes. And if person is able to extend this asana for more time by practice, not today we started this and doing for 3 minutes, 4 minutes, 5 minutes. No. So gradually we increase every asana stay time in 5 seconds, 10 seconds, 20 seconds, 30 seconds. Gradually then we can improve the movements and we feel the relaxed condition. So what is this? This yoga module symptoms, the result is this is a result, how it decreases the pain, stiffness, and improve the movements. Okay, so this is a pain is first is 3.66%, and after that it is and stiffness it also decreases, and difficulty in movement after 4 activity of yoga practice, it decreases like this. So this shows the proper practice. We can also eliminate this is decrease, and if we continue for 6 months, then it obviously it proper manage the pain and prevent the next coming diseases. This is the and it shows the very significant result. in all the three symptoms. After the proper trial, we tried 30 patients for 4 weeks. So it showed a very significant result before and after in the all three symptoms. How we can do this? This this is just a simple exercise. It's a very scientific actions over the body. General physical activity maintains lower level of inflammatory markers. While pain occurs, continuous sitting postures and one level posture increases the inflammatory actions and that causes the pain and stiffness. And if we started the physical activity, means we change the postures regularly and in a specified manner, then it decreases the inflammatory markers. That's why more active persons and sedentary persons have different level of pain perceptions. Sedentary persons have very low pain perception. Very easily, low level pain we can feel very high. But in the physically active persons, it is high threshold. Means have a more power to stay the and to decrease the pain, and because due to low level of inflammatory markers in the highly active persons. Which person is more physically active have low inflammatory markers, and it is also other way it also promote the health and it maintain the weight also, bone mass and muscle functions, means proper function of the body, all muscles and joints is also maintained by the physical activity. And physical activity, if can do this type of actions, obviously in a specified posture like yoga asana, obviously do very much effective on the body. So different types of asana, this module have these asanas have a specific action on the lower back area. That's why we are selected these asanas. Just Urdhva Hastasana have upward and downward stretching, means just action as a traction. Means if space between the vertebrae is decreases, considered to polyphase, then stretching gives the proper space. It provides the space for the proper movement, and it also stretches the muscles. When muscles is polysis due to proper sitting and compressed condition. So if we stretches our body, just a simple up hand over head and stretch the legs downward, we feel some stretch the lower back and whole spine, whole vertebral column, and we can feel this relaxed condition. So this is a downward and upward stretching force which act as a traction. Same as the Kati Chakrasana. Kati Chakrasana is the twisting, give the twisting force, right side, left side, body and vertebral column. Along one side muscle of back is relaxed and one side is twisted, stressed. Next we can turn the right side, then we can feel one side is relaxed and one side is stressed. So continuous 5 to 10 times twisting force will give the proper movement of the side muscles of the back, and also plus the deviation of vertebrae right side or left side we can fix on the same level and in the particular straight line and maintain the curvature. It also just in the right side and left side, both is required, not only left, not only right is required, both is required because they can act on a proper balancing the vertebral level. Next is Bhadrasana, very simple and easy asana. Person can do very easily. It also gives the side and upward stretching force. Side we can when we can join the sole both of both legs and try to touch the knee. Then feel some stretching force in the sideways and obliquely. And this is due to quadriceps muscles, Schwas major muscles, and upward stretching due to back muscles. So these muscles very simple can do very easily and give the balancing and sidewise and give the broad space for the lower back for sitting posture. So this is a upward and side stretching is also required for the balancing the lower and complete column. Stage upside, up and side stretching, and also from front side is also muscles is involved. Abdominal muscle, chest muscles, and back muscles is stretched and relaxed. Stretch and relax, and thigh muscles, side muscles is also involved for balancing the mm, joints movements. Joints, if any deviation in the vertebral column, we can use this type of different asana, then can balance the level of vertebral column. This is a very simple Uttana Mandukasana. It is up and side stretching and also the front side muscles. So these asanas is a very easy and every person to do regularly. Next is the Setu Bandhasana. Setu Bandhasana is also very easy. It is not necessary to hold the ankle joint. Not able to hold and grip the ankle joint. It's only palm on the floor and try to lift back. Try to lift. If able to lift, it is a good. Not able to, try to lift, and gradually it is going to upward and able to do in 10 to 15 days. So it also gives the curvature. It maintains the curvature of curvature of the spine, curvature of the vertebral column. It involves the back muscles, abdominal muscles, neck muscles, leg muscles, hand muscles. These muscles is very much stressed and giving the compression of back muscle. Compression of back muscle. But over front side muscle, thigh muscle is stressed, but back side muscle is contracted. So continuous stretching, then after contraction. So not only stretching, not only contraction is required. Both step by step is required. So it started with um, Urdhva Hastasana, Kati Chakrasana, Mudrasana, Uttana Manduvan. This is the upward stretching. And this Setubantasana gives the relaxation, contraction in the back area. Same as Salabhasana, in the curvature. Obviously, we can see this when we lift the legs. If not able to lift both legs same time, we can do one by one. So this is gradually then we can able to do it. So just try to lift the leg and it maintain the curvature. Means S-shaped curvature of vertebral column is very much important for proper movement of the body. Otherwise, if any type, any level, at any level, means thoracic level or over cervical level or lumbar layer, sacral, anywhere, if we loses the curvature or disturb the curvature, we feel pain and difficulty in movements. So if have any lose the curvature our cervical level, obviously or feel the pain and difficulty in movements in the neck. And same as thoracic and neck, lower back area is more prominent because obviously when we sit and have a tendency to feel forward bending, forward drooping of the body. So lower back area is very much affected. Very, if person is very conscious, then a proper proper straight way. Otherwise, person have a tendency to down in the forward we bend this. So lower back is very much, and neck area is very much affected. Cervical and lower lumbosacral area is very much affected in the sitting posture. So, the main curvature maintain curvature of vertebral column. Same way, Bhujangasana means if we from the back side, if we lift the back side and the lower limbs, then this is a Salabhasana. When we lift the upper body part, means chest and head with the help of hand, it is a Bhujangasana. Both asana give the proper tone up, proper contraction which maintain the muscle, then muscle maintain the curvature of the spine. We see this in the report. We have person have scoliosis, some deviation, collapse of the vertebrae, collapse of the vertebrae. All these is the curvature problems. And curvature along with the deviation of the vertebrae, space decreases. If we traction with the proper bending, then it maintains, and sidewise also is required side movement because the muscle the vertebrae on both sides and try to keep them in the center. Maintenance of pitch and alignment of the vertebral column and proper spacing of the vertebral column. It is a three main part for relieving the pain and cause of the pain. So when these three is proper, then have no pain and stiffness. It is generally low back pain is started with stiffness and gradually movement is restricted. After proper, all these asana minimum 5 to 10 round is required. Means just stretch and relax after 5 to 10 seconds or as much you can maintain. So continuous stretching and contraction muscle tired, then give the relaxation condition. Relaxation pose is also required. During this, Savasana is the best way for relaxation, easy and best for relaxation of mind and whole physical body. If mind is relaxed and then person feel no pain in the body, have less stretching condition, less contracted muscles, so person feel less pain. So all these situations, all these asanas is in a particular conditions, in a particular direction, it gives the particular force and particular activity. So this is a very much uh, means just comprehends conditions. Means very easy and very short conditions. Any person we can do. Person can do this at even at a home. Start with 10 minutes, 15 minutes for 1 hour. It is sufficient for back. Started from just for doing the warm up, then standing posture asana, sitting posture asana, supine and prone position asana. So I end with the savasana. And but this is a physical activity. After that, mental relaxation is also required. Pranayama is also required for proper flow of energy in the whole body. Not only work on the brain, it also work on the whole body. Pranayama in this situation, in the COVID situation, for respiratory health is very much important. So Nadi Sodhan is just a simple remove the obstruction from channels of the body where pranavayu flow. So Nadi Sodhan and Brahmari Pranayam. Just vibration also give energy. Brahmari Pranayam gives the energy and also remove the particles and obstructions with the vibration. So Nadi Sodhan and Brahmari Pranayam is a complete give the complete relaxation for body and mind also because it starts the proper flow of energy. It is a proper flow of energy in the direction of right and left Surya Nari and Chandra Nari. So proper flow of energy is required. Otherwise, it causes blockage and inflammation. What is it? Just inflammation activity, inflammation factor means blockage of energy. So proper flow of energy in the body is very much important for proper function of the cells. So in the conclusion, we can say that every asana have a specific activity, a specific movement, and it secretes the chemicals, just serotonin, and it decreases the tumor necrosis factors. So it decreases the inflammatory factor and increases the soothing factors and chemicals which relieve the pain. It all the physical mechanism, chemical and neurological. Both condition is all three functions appear in the yoga asana, not physical exercise. Prepared and specified asana is very much effective in the particular conditions of the body. All the categories of different asana. More other asana is also there, but mm, it is decided on the consideration of people which we can able to do very easily. So this is a simple module by person. We can do 15 minutes, 100 means just a simple at a home, not required any specific yoga hall or any centers. In the situation, we can do very easily. I have no need of any observation or guidance. This is simple. We can do very easy. So this is by considering general population. We design this different simple different asana group one yoga module and prepare yoga module. If this yoga module person can do this for 1 hour, it's very effective and manage the chronic low back pain and improve the quality of life. It is very important. As of today scenario, it is very important for other lifestyle related disorders is also because cardiac problems, hypertension, and different types, obesity, diabetes, all these are we can manage by the simple yoga asana. Continuous practice, not only we can do for 10 days and after we can stop this. So it is a daily routine work. Just we can add this daily routine work. Then we can manage and prevent the lifestyle related disorders in the present situation where have a disease and very much painful life and decrease gradually quality of life. So every person can do this very properly and easy for performance. So with this baby go and be at home rotation, we can end our topic. Thank you. Any questions now at the end of this? I want just have any question from the audience side. I am ready for giving the answer.
Ma'am, thank you for your informative session. There are a few queries from our audience. The first one is difference between the effect of asana and physiotherapy stretching. कि यदि कोई इंसान लो बैक पेन के लिए फिजियोथेरेपी स्ट्रेचिंग करता है या फिर आसन करता है तो उनका किस सेंस में किस तरह से डिफरेंट इफेक्ट हो सकता है या सेम इफेक्ट है.
Sir, just a physiotherapy is a forceful stretch. I treated one patient is also come in the hospital where person do only simple yoga by their personal strength means without any force then have no any kind of muscle injury After, due to lockdown, patient started physiotherapy. And after some time, they feel muscle injury, and then it becomes as a new disease. So yoga is when I always say that do with minimum time as your strength, 5 seconds, 10 seconds, 13 seconds, 15 seconds. But in the physiotherapy has perfect module. This type of activity do 10 minutes. This type of stretching do up to this. So this is a forceful activity, have a chance of injury. But in the situation of already body is injured, in this situation, gradual improvement is required as the means as a strength of patient. So just this is the first main thing, and other thing is there, mental effects is also there, and some chemicals is releases. That's why yoga asana have different, and physiotherapy has, because in the physiotherapy mind is always in stress condition, but during doing asana, person feels some enjoyment and feel some relaxation. Just a simple difference.
मैम दूसरा डाउट है, एलबीपी में योगासन को कितने दिनों तक करने से आराम मिल जाता है?
Just aram just within 1 week. Person feel, because first 3 days, if person not doing any physical activity, first 3 days feel some stretching pain just in the thigh, side, flank. तो ये 3 दिन उनको एक नए पेन का अनुभव होगा, जो कि स्ट्रेचिंग पेन है, क्योंकि उनकी बॉडी कोई काम नहीं कर रही थी, कोई मसल एक्टिविटी नहीं थी. तो आफ्टर 3 days इट इज सबसाइड, and their original pain is going to subside and means decreases day by day. And within 1 week, patient feel very much relieved within simple 1 week. And I try doing this research for 4 weeks. And at the end of 4 weeks, I showed that data. It is a very much effective. Patient is into their normal life, normal routine life. So it is very effective without any medication. But if have any injury in the spine, obviously we require other treatment. So in my group, I excluded injured patient. Any kind of spinal injury, I excluded that patient.
थर्ड क्वेश्चन है, कितनी उम्र के बाद इन आसनों को किया जा सकता है?
This is a very simple asana. I think this is also done by simple children also can able to do. Because after 10 years, 15 years, it is able to do. This is not a strong asana. I think children's this type of activity doing daily in the play condition. So it's not a harmful, easy to do. Even
जी
can children also able to do.
जी राइट मैम, थैंक यू। यही डाउट्स थे हमारे कुछ पार्टिसिपेंट्स के। नाउ आई विल ट्रांसफर द माइक टू डॉक्टर धनराज सर, प्लीज।
थैंक यू डॉक्टर शालिनी बोस, जो आपने अपने व्यस्त समय को हमारे लिए निकाला और हमारे शॉर्ट नोटिस पे आप वेबिनार करने के लिए तैयार हुए। आपका जो वेबिनार है वो हमारे लिए ज्ञानवर्धक होगा। जिन ऑडियंस ने इसमें हिस्सा लिया है उनके भी ज्ञान को बढ़ाने वाला होगा और वो लोग आगे जाके इसका जनहित में उपयोग करेंगे। इसके लिए बहुत बहुत आपको धन्यवाद। मैं इस चीज़ के लिए आपका आभारी हूँ। आगे भी अगर हमको ऐसी ज़रूरत पड़ती है तो मैं आशा करता हूँ आप हमारा निवेदन स्वीकार करेंगे। इसके साथ ही मैं जो वेबिनार सीरीज के रिसोर्स पर्सन थे डॉक्टर कमलेश कुमार जी शर्मा, जो हमारे गुरुजी हैं, उनका भी आज हृदय से आभार व्यक्त करता हूँ कि शॉर्ट नोटिस पे सर ने हमारा निमंत्रण स्वीकार किया और हमको इस वेब सीरीज में उन्होंने हिस्सा लेकर के हमारा ज्ञानवर्धन किया। उनके उन्होंने जो हमको बताया उससे कई व्यक्तियों को लाभ होगा और हमने सुना है उस आधार पे हम जनहित में इसके लिए काम करेंगे। इसके साथ ही में धन्यवाद देना चाहूँगा डॉक्टर काशीनाथ जी का, जिन्होंने भी हमारे शॉर्ट नोटिस पे हमारा निवेदन स्वीकार करके हमारे वेबिनार की को आगे बढ़ाया। इसके साथ ही मैं सभी ऑडियंस का धन्यवाद ज्ञापन करना चाहता हूँ, जिन्होंने हमको लगातार जो स्वस्थ व्रत सब्जेक्ट थे उन पे 3 दिन की वेबिनार सीरीज थी, जिनको सुना। और मैं आशा करता हूँ कि आप लोग जो चीज़ों यहाँ पे आपने देखी है, सीखी है, बताया है, उसका आगे जनहित में उसको आगे बढ़ाएंगे और लोगों के लिए लाभकारी सिद्ध होगी। इसके साथ साथ ही में हमारे प्रेसिडेंट सर गांधी विद्या मंदिर श्रीमान हिमांशु जी दुग्गड़ का भी आभार प्रकट करना चाहता हूँ कि इस वेबिनार सीरीज के लिए जो हमारे कॉलेज में और सब्जेक्ट की भी चल रही है उसके लिए हमको प्रेरित किया। साथ ही सचिव महोदय गांधी विद्या मंदिर ब्रिगेडियर श्रीमान अजय पति जी त्रिपाठी का भी मैं स्वागत करता हूँ, धन्यवाद ज्ञापन करता हूँ, जिन्होंने हमको सारे संसाधन उपलब्ध करवाए। के साथ ही प्राचार्य महोदय श्री भंवरलाल दुग्गड़ आयुर्वेद विश्व भारती, डॉक्टर रविंद्र जी सर का मैं हृदय से धन्यवाद व्यक्त करता हूँ, जिन्होंने हमको इस सीरीज को कैसे करें क्या करें उसके लिए गाइड किया। इसके साथ साथ ही वेबिनार समिति के समस्त सदस्य श्री डॉक्टर सौरभ अग्रवाल, डॉक्टर आशा केपी, डॉक्टर कीर्ति राहुल और डॉक्टर लोकेश शर्मा, इनका भी मैं धन्यवाद करना चाहूँगा, जिन्होंने दिन रात मेहनत करके इस सीरीज को सफल बनाया। इसी के साथ मैं आप सभी ऑडियंस को इंटरनेशनल योगा डे पे होने वाले हमारे लाइव कार्यक्रम के लिए आपको आमंत्रित करता हूं कि ज़्यादा से ज़्यादा संख्या में आप आएँ और जो अंतर्राष्ट्रीय योग दिवस पे जो कार्यक्रम होने वाला है उसका लाभ उठाएं, उसको आगे बढ़ाएं। इसके साथ बहुत बहुत धन्यवाद सभी को। नमस्कार।
नमस्कार। एसबी आयुर्वेदिक कॉलेज के सभी